I'm demonstrating how to do an IV StatLock. You'll find these on your midlines from IR as well as all of your PICC lines and central lines. So first you're going to take your dressing off as normal using some alcohol. Peeling away from you. And if you need to use some saline, you can do so to get that gel to come off easier. And then you're going to really rub this with alcohol to get the StatLock off. So it's probably easiest to disengage it from the catheter first. So using your thumb, you're going to flip up this corner edge, or your index finger works too. Lift the catheter, kind of set it to the side, and then you can really work on getting this piece off. Sometimes it's nice to have another person helping do this. Got the StatLock off. If you feel more comfortable, you can use the piece of tape that comes in your top part of your dressing kit to tape that down until you're ready to dress it. Package and empty it onto my sterile field. I've washed my hands and put sterile gloves on. Now I'm ready to put the StatLock and dressing back on. So I like to use these gauzes just to kind of help hold my line. And I'm going to use the ChloroPrep, of course, to do your 30-second scrub back and forth, making sure you get under the line. Make sure you let that dry completely. Then, of course, you want to use your skin prep to go on about 1 inch from your dressing. Let that dry completely. And you also, I'm sorry, want to make sure you get under here where the StatLock's actually going to go with your skin prep. Now it's time to add the StatLock. When you're adding the StatLock, you're going to do it with it not attached to the patient yet. So you're going to put in one peg first, snap it in place, and then you're going to put the other peg in. And these pegs, they will actually move. And then snap that into place. Okay. Now you're ready to peel one side off, stick it down, and then peel the other side off and stick it down. Final steps would be to put on your CH dressing as you normally would. So you center the gel part over your insertion site. And secure the bottom piece like you normally would. And make sure that every time you do a dressing change that you actually change the StatLock out as well. Last step would be to date and time your slip and put it on top of the dressing.